I'm Dr. Angela Canfield from Sandfly Family Dental, and I'm glad that you could make it out for my discussion on the differences in orthodontic procedures. So orthodontic treatment is basically the movement of teeth to either correct your bite or for cosmetic reasons. Different types of malocclusions, trauma, things like that. There used to be just the traditional metal braces that you would see people wear and still do today. But there's also some other options to move your teeth, such as clear braces or clear aligners, and one example is Invisalign that I do here at my office. Orthodontic procedures is important even if it's not for cosmetics, because you don't care about the cosmetic part, but if your teeth are not hitting in the way that they should hit, then they can cause damage to your teeth. So over time you can end up needing a bunch of crowns, or you can end up losing your teeth. If you're pounding on a tooth in a different spot where you're supposed to be when you're chewing, then it can cause damage to the tooth. So that's why we want to correct your bite, to be able to make it look pretty, plus also to function better. So usually whenever you come in for your cleanings, we always check by x-rays and by an exam. We check your bite, we check to see if you do need ortho, and then from there we discuss what your ortho options are, if you need to go see an orthodontist or if we can take care of you in-house. So the difference between traditional braces and the clear aligners, the Invisalign that we do here, the cost is pretty much the same. There's not really much of a difference to make a decision. The time frame that you would have to wear either or is pretty much the same as well. Sometimes Invisalign is a little quicker than the traditional braces, but it's a minor difference as far as that goes. But some pluses with the clear aligners. If you play an instrument, for instance, you can take the clear aligners out, where with the braces they often get in the way, especially for like teenagers that happen to be in band or something like that. For people that play sports, it's really good too, because like if you play football and you have braces, you get hit in the mouth, it can really tear up the inside of your mouth, even if you have a guard in. But the clear aligners kind of is an extra protection for athletes, plus they can be taken out as well, so you don't have the braces that are glued to your teeth that causes damage. So in that aspect it's good. It's also good for adults, because the way it moves teeth, the pressures it puts is a little different than what it is traditional braces, so it doesn't cause the root resorption that traditional braces can cause for adults. So whenever traditional braces are moving your teeth, they put a little bit faster, more pressure on your teeth, and it can actually cause your roots to kind of shrink, shorten. So the pressures that the Invisalign put on is not as much, and you don't get the root resorption. So as kids, when we move your teeth, you know, your bone's not quite like it is when you're an adult. Things aren't settled like it is when you're an adult. So kids' teeth move pretty easily. Adults' teeth move a little slower than kids' teeth. So that's kind of the plus to Invisalign. Plus too, you can eat anything you want. You don't have to worry about, I mean, as far as if you want to eat corn on the cob, or you can eat all that stuff, where in traditional braces you can't, because you take out your Invisalign aligners to eat. So you can eat what you want. Hygiene, keeping your teeth clean is so much easier, especially for teenage kids, because you take them out and just brush and floss like normally. Where if you have the traditional braces on, you know, flossing's much more difficult, brushing's more difficult, your gums get swollen, things like that. So there's a lot of pluses to the Invisalign. So if you're in here for your regular cleaning and you are a candidate for Invisalign and you want to go ahead and proceed, the process is basically we take impressions. Once the impressions are taken, we send them off to be scanned into like a 3D scanner. And once they're scanned into the 3D scanner, it's sent back to me on the computer in a database. And then I design your treatment of where I want your teeth to be moved, how we're going to move them. And then once I approve how I want the treatment to proceed, then they make the clear aligners. And then the clear aligners are sent to me. You come back and we start treatment. Okay. So these are actually a set of aligners for somebody. They have little bumps on them. I don't know if you can see it very well, but those are little attachments that'll hook to your teeth. So on your teeth, you're going to have like a little clear bump that you can't see. You can take pictures, they'll never show up. You can even wear these in pictures and you'll never see them. But that's what puts pressure on your teeth. But they're just clear aligners. that pop over top for the top and the bottom. And then they've also, this is good for especially for teenagers, it's got a little blue indicator on there, and you wear them 2 weeks at a time, and then you switch them out. So on teenagers, we'll be able to tell our kids if they've been wearing them or not, because the blue dot fades over the 2 weeks. So if they come in and they look like this brand new, then we know the kid's not been wearing the aligners like they're supposed to. So basically, we want you to wear them all the time except when you eat or when you're brushing your teeth. So 18 hours is a good estimate, is what we would like for you to wear them. So basically, take them out to eat, take them out to brush, and put them back in. Sleep with them. Yes, you need to sleep with them. People don't like to do, especially adults or even teenagers, don't like to do the traditional braces. So it doesn't look very cosmetically pleasing, especially adults if they have to be out working. They don't really want to have those on there. And even teenagers now, you know, if they're in pageants or they've got prom or graduation pictures and things like that, or play sports or that, they don't want to wear them. So it does the exact same thing. So at the same speed, basically the same cost. The only thing is with a kid is you just have to make sure they're responsible enough to wear them. That's really the only disadvantage of these versus traditional braces is that your child just makes sure that he or she is responsible enough to wear them the time frame that needs to be worn, because you can take them in and out, where braces, they're there. So yeah. There are a few cases that with like class 3 malocclusion, which is kind of like an underbite, that Invisalign won't treat. But there's a small population in the world that has that. So that's kind of not an issue. But yeah, it moves just the same. But like I said, you do just have to make sure that your child wears them. Because if you don't wear them, your teeth won't move. The adult Invisalign treatment, there's not, if you lose them, there's not a warranty. But with the teen, they can lose up to 3 and replace them, and there's no extra charge. So that's kind of good, because teens tend to be the ones that misplace them, throw them away in the cafeteria or whatever. So whenever the first time that you come for the appointment to actually get your aligners after the impression stage, usually we give you 1 set for 2 weeks, and then we get you back, because we just want to make sure you're not having any problems, that there's no issues, everything's fitting fine, you can get them in and out okay, you're not having any kind of complications. Once that's done, then every 6 weeks. So it's pretty much the same as traditional braces. Every 6 weeks you come back to see us. We give you 3 sets of aligners. You change them out every 2 weeks. Another important reason to get some type of ortho treatment is if you have TMJ issues, which symptoms can be sore jaw, headaches, even like neck muscle pain. All that can be because your muscles are connected to your temporomandibular joint, which is your jaw joint, and all that's connected to your neck, and that can cause problems. So and usually the problems are caused from a malposition bite. So if you're not biting on your teeth properly, like I had said before, then those other issues can cause a problem. So if we can correct that, then it usually resolves your TMJ issues. And even like grinding and clenching your teeth, that can be an issue, a bite issue. This can be a symptom of a bite issue that can be corrected with Invisalign or an ortho procedure. So whenever your bite is off, which is a malocclusion, it's what we call a malocclusion, when you're biting on your teeth improperly, over time it can cause pressure, which can cause your bone to resorb, and then which is periodontal disease, when you lose bone around your teeth. So if we correct your bite, then there's less likely of a chance that will happen. Also, if you have crowding, it's very hard to keep things clean. So bacteria builds up, and then you can also lose bone that way. So people that have really crowded teeth, tends to be over time around those areas you'll get perio involvement. So if we can straighten them and make things very easy to keep clean, then you don't have the perio issues. Periodontal disease, the end result can be that you can lose your teeth. Also, the other issues is it's bacteria that's in your system. So, it can go to your heart, to your brain. It can cause a lot of systemic issues health-wise as well. Let alone it can cause just the bad breath, staining on your teeth, bleeding gums, sore gums, painful mouth. But the big things are you can lose all your teeth, or it can cause other systemic health issues. So I encourage people that have malocclusions, have deep bites, have grinding issues, TMJ issues, spacing, crowding, have problems keeping their teeth clean because of that, to see their regular dentist and inquire about ortho procedures, or find a local dentist near you and inquire about that so you don't have further damage to your mouth. Here at Sandfly Family Dental, we offer a free consultation to come in, and we kind of look at everything, take some measurements, and see what you're a candidate for, and then proceed from there. And if you have a healthy smile and a healthy mouth, then overall you're much more a healthy person, systemically.